Dr. Desai, you are a former epidemic intelligence service officer, which leads me to believe that you need data to do what you do. I understand that in an epidemic, not 100% of people need to be tested. But again, when I've studied what has happened in TB in this country, it was about intelligence. TB was defeated by intelligence, by knowing who had it, who they were with, who they were around, and then treating them for it. What can be gained by not having enough testing? And what is the right amount of testing? What percentage of the population needs to be tested? How do we know who to believe about testing?
So just to be clear, when you have testing available and it's rapid testing and you think it's reliable testing, you want to use that testing as broadly as possible among people that you think might have COVID-19. Today, I would say almost everyone in America might have COVID-19. And so if we could do blanket testing, that would be fantastic. And there are certain cities and counties that are trying that approach. The other piece of this is that testing falls into two categories. There's looking for the viral RNA, RT-PCR, which is the Abbott Lab image that you just showed. There's also serology testing. And I think one of the beautiful things that we will likely take more and more advantage of over time is serologic testing to see who had COVID-19 and who is now immune to COVID-19. Both of those types of testing are absolutely crucial and necessary, like you said, in an epidemic like this one. You can't go and fight an opponent blindfolded.